And welcome. I think everyone is streaming through the virtual door. Thank you very much, everyone, for joining this afternoon. Who are we? Let's just say a word on that before we get into it. So we are Kaleidoscope Health and Care, the least easy to spell organisation currently working in health, a not-for-profit social enterprise. We have a mission to work with others to create a future which is kind, connected and joyful. One of the ways we do that is we provide consultancy services to a large number of organisations in the NHS. But also, if we've got any money left over, we will self-fund projects which go back to meet our mission, such as what unites us. That is us. Welcome those who've just joined. Again, my name is Rich, part of the team here at Kaleidoscope. So what are we up to today? Three objectives for our time together. Firstly, hopefully to help us all understand a bit more about what the point of this thing is. And explore what it means. Delighted that we're going to be hearing from the entrants and some of the judges from the prize about why they chose to be part of the project. My spouse told me to. Could be a legitimate reason, which is going to come up later. And of course, we're going to announce the winners of the prize as well. We have an agenda which arbitrarily divides the time up between now and 5 o'clock. So you will be hearing from, over the course of the next hour or so, from our shortlisted entries: Natalie, Kelly, Rachel, Liam, I think Claudia for joining, Claire, Larry, Nikki, Nina, Ceylan, and David joining from judges as well. So a galactico of stars. Thank you all very much for joining. We are a reasonably large group. So I thought what we could do just for introductions is that we might just go around everyone, if that's okay. And if everyone could just give us like a 5 to 7 minute individual biography, starting with where you went to school, any school badges, clubs, you know, that sort of thing. Then no, not going to do that. Not going to do that. We're going to pop over to Menti. Please, we're going to pop over to Menti. There'll be a link in the chat in just one moment. So today's event, What Unites Us, and we'll talk a bit more about this in a moment, is all about what unites all those working in health and care. So you can tick as many of these as you like. Over the last year, which of the following have you had contact with? And just to be clear, what we're talking about here is in their job, not just as your friend. So if you're just very well collected to medici friends, clinical friends, but over the last year, which of the following have you had contact with? We now get to be slightly dazzled by blue orbs flying across the screen. But over the last year, which of the following have you had contact with? Thank you very much. Robert joining, Blob in London. Thank you for joining, Robert. Well done, multitasking, joining with childcare as well. Fantastic, thank you very much. We've got a pretty good range of GPs and practice staff leading, pharmacists, physios, public health staff, dom care staff as well, ambulance staff as well, thank you. But part of why we're doing this, as with all of this prize, is just to show actually both the diversity of those who work in health and care, but the range of contact points we all have with so many people playing critical parts of the jigsaw which makes up our health and care system. Again, if this was a 4-day event, we would then stop here to go into each of our own personal and professional experiences from coming into contact with each of these professionals. We are not going to do that. Lovely, thank you very much, everyone. Next one. Okay, all right. We're going to hear from David and Ceylan, two of our wonderful judges, later on. But to begin with, we thought actually we might just give you a taste of being the judge. So we're going to give you a set of questions which are from the non-shortlisted entries. So for any of our shortlisted entrants on the call, wondering that you're just about to be judged by your peers, we're not doing that. These are questions from the non-shortlisted entries. And we're going to give you pairs, and we're going to simply ask you, which do you think are the best questions to get at the heart of what unites all those who work in health and care? Our criteria, which we gave our judges, was relevance, insight, and creativity. So you might have that at the back of your mind. But which of these are the best to get at the heart of what unites all those in health and care? You're welcome to put comments in the chat as we go. Right, first, pair of questions. So how would you, so two questions here, which do you think is the better to get the heart of what unites those who work in healthcare? How would you know what is most important for a person, or work with others to meet a person's needs? Having this on the screen with the results there does give a bit of an advantage to whoever votes first, and everyone else can vote alongside. It's coming back. Okay, lovely. Thank you. It says, so it's knowing what is most important for a person who I think is going to clinch it. We'll give people another couple of seconds. I should say, for those of you who have found the What Unites Us section on the Kaleidoscope website, you'll find a whole raft of questions which came through from a range of entries. Okay, we're going to leave it at that. Know what's most important for a person wins out. Thank you. Next one. What do you think? What do you think gives people a good life? What do you think gives your life meaning and purpose? You are in the What Unites Us interview scenario. You are trying to judge what is best at getting at what really unites those who work across health and care. Which do you want to ask? What do you think gives people a good life? What do you think gives your life meaning and purpose? There we go. How much philosophical thought have you had at 4:11 on a Friday before? We're not going to ask you your answers to all of these questions. I mean, how long is this interview going to take? It's going to go on forever. What do you think gives your life meaning and purpose? And can you give us a 30-second answer? Love it. Okay, thank you. Two more of these. So what do you ask? Do you ask, how would you motivate a team with compassion fatigue? Or do you ask, how would you handle sensitive conversations? Which one do you want to ask? Again, these were a range of questions submitted by non-shortlist entries. Okay, compassion fatigue is winning out. Lovely. Thank you. We will share back all of these results afterwards. We're going through quite quickly, but we will share back. Finally, last one. What do you want to ask? What do you want to ask? Can a robot care? Or how would you use a magic wand to care for others? You would have a magic wand to wish for anything your heart's desire. How would you use that? Can a robot care? Which you want to go for? There we go. The wand wins it. Okay, thank you very much, everyone. We're going to pop back. And what we're going to say is that this is what we want to do is just give you a little slice of both some of the difficulty in judging a whole range of these questions, which just makes you want to stop and try and answer them, but also how the prize is all about trying to get into a space where you do stop and think, well, what would my answer to that be? What would the response look like if we were thinking about the workforce across health and care, which is best going to live up to what we want our system to do? And on that note, so what's the point of all this? What is the point of What Unites Us? So this starts from the perspective of, we talk about health and care as something which we want to work together. Everyone, pretty much anywhere in the world who you talk to about the future of health and care will talk about a system which works more together. So it'd be perfectly legitimate in this joined up system for someone to come along and say, yes, I would like to work in health and care, please. That sounds great. To which you might get a response which says, yeah, lovely. Okay, good. If you'd like to just come through this door here. Oh, you don't want to be a health visitor. Oh, what about this door over here? You can be a doctor, or you can work in policy, or you can work in a domiciliary care home, or what about a life as a physiotherapist or a policymaker, or we create in health and care hundreds and hundreds of doors. We create hundreds and hundreds of different ways into this thing, which we try and pretend is all linked up. So you sort of end up in this situation that you can think, great, okay, well, if you had a house which had all of these different doors, right, what might that overall house look like? Possibly it would look something like this, for which I have to give credit to the wonderful Instagram page, Ugly Belgian Houses. There you go. If you take nothing away from this event today, Ugly Belgian Houses is the next thing you're going to follow on your Instagram feed. But the point here is that, as the wonderful Paul Bedowden once said, every system is perfectly designed to get the results it gets. If we create a system with lots of different ways in which look very different to each other, why are we surprised at the end that this isn't a system which is perfectly joined up? So what do we do? So our version of this, as we all know, is that we have hundreds and hundreds of roles all across healthcare, all across the NHS, all across social care, giving a different way in to our health and care system. At the end of all of this, you'll get some people exhorting all of those who work in health and care to say, great, good, can you work more together, please? The main reason for this prize, the main thing we were trying to get at, is that trying to get everyone to work together as one when they're midway through their careers is a bit late. So surely there must be a better way to think about how we all work together across health and care. Very much linked to this is work which we do at Kaleidoscope, where we look at how people collaborate and what are the characteristics of those collaborations which really work. Our starting point is always, what is the shared purpose on which people work? So here we go. What unites us is this hypothetical situation where you have an interview with 3 questions that get to the very heart and soul of what working in health and care is all about. We opened the prize. Anyone was allowed to submit their questions. We had a wide range of entries. So if you are joining today as a non-shortlisted entry, thank you so much. Non-shortlisted entrant, thank you so much for doing so. We asked people to give us their 3 questions, a short rationale, and there are prizes, which we're here to do today. So that is enough of the background. We're going to get on to actually, okay, well, what are these questions? And let's hear from some of the people who submitted them. So we're going to go through our entries. So first, Kelly, we're going to come to you if that's okay. So we'll go through, and if people just want to pop off mute. But Kelly, good afternoon. Thank you so much for entering. Kelly, do you want to talk to us a bit about your entry and what was in your head when you were drafting this?
Yes, thank you so much. I'm really happy to be here. I'm really excited that you all put this contest together. So for these questions, I was really focusing on how important storytelling can be and giving people the opportunity to share their experiences and views of the world. And I really think that can be a powerful tool in thinking about interview questions. And I really tried to focus on my first question, asking them to tell a story of what it looks like and means to them to receive care. And I tried to open up the way of thinking about that beyond a healthcare setting, so people are really expansive in their thinking about what care looks and means to them. And the second question, I focused on kind of how, where, and why they found humor in their careers in healthcare and studying to be in healthcare, because I really think that humor is such a big and important part of being able to navigate complex systems and long careers. And so I hope that kind of question can help people tell a story of how they see the world and relate to others. And then my last question involves imagination, so they can tell the story of what they kind of hope for, and particularly if it's situated in a space, so they can kind of describe it in both tangible ways and symbolically. So I thought that could give people a range of ways to explain what matters to them. And overall, my questions are just really designed to bring about stories where people felt connections to others, because I think understanding how people make connections to others is really a key component of how they are able to offer thoughtful care. So I happened to find out about this via a tweet, and I'm so glad that I got here. I'm one of the people that's in the sea in the image. So thanks for having me.
Yeah, Kelly, people might guess that you're not from one of the, well, not from within inner London anyway. Kelly, do you want to just talk a little bit about your background and how that relates to some of the questions?
Yeah, absolutely. Yeah, so I have a background in health psychology, public health, and human-centered design. And I've worked in a variety of different settings where I've done a lot of qualitative and participatory research with patients, healthcare providers, caretakers, both in digital health and in other broader public health systems. And so a lot of my work is getting to hear people's stories. So when the idea was the interview question, I thought, oh, that's what I do all the time. And so it was a really fun opportunity to think about, hey, how could we revisit and think about the interview process for becoming a healthcare provider? So I got to use my background to think through these questions.
Right, so have you road tested any of these, Kelly? Have you tried them out? And what responses did you get, if so?
I haven't tried them out, but I'm actually really curious to try the one where people describe the space, because I think people have it can be easier sometimes to describe and point out spaces, or even if they drew it out. I just think there's a lot of ways you can kind of get and learn from people when they're thinking about new spaces that they would want to create, and what that means to them. So that's the one I'm most excited to try out.
Lovely, thank you. Again, the temptation to extend this meeting to one which is several hours and we each answer these questions is quite high. Kelly, thank you very much. We're going to go on, but as we go through each of our shortlist entries, if wherever we are, can give a physical or virtual round of applause. Kelly, thank you very much indeed for your entry. Fantastic questions. We're going to come on next to Natalie. Hello, Natalie. Thank you so much for joining. If you want to pop off mute. Natalie, do you want to sort of give a bit about your background and what that contributed to these questions?
Sure. So I use my lived experience to improve health and care. So that goes across NHS in research, and I use my experience of being in foster care to improve the foster care system. So a lot of this was just based on my own experiences. I had recently had brain surgery when this popped up in my email. So I was off work recovering, and after getting a bit bored binge watching a series on TV, I sort of started getting back into my emails. And so I saw this and I thought, you know, this is actually just something that has been in my mind after sitting on, you know, numerous interview panels, and just feeling like the questions were so mundane, for want of a better word. I wasn't getting to the heart of what the people, you know, were like, and, you know, their values, and that's sort of what set me doing these questions. I wanted to take a bit more of a different approach. So I worked with children for 15 years, and working with children, I could see how creative they were, and they don't really let things inhibit them. So I kind of wanted people to sort of reach into some of those things that they might have experienced in childhood, like fairy stories and that kind of element, to be able to dig into something a bit more creative. So that was kind of the basis around why I did sort of the 3 wishes, and sort of coming up with, you know, somebody in history and creating like their perfect colleague. Because then I thought that it's not really questions that you would just already have an answer to, and people have to kind of really get to the heart of it. I really wanted people to like search within themselves to see what issues they'd come up with. So not just local, but global. So for me, anyone in any job in healthcare, it's not just about the job you're doing, but the wider impact that has. The leadership question, I really wanted people to see themselves as leaders and not just following, you know, what they're told, but like whatever role they're doing, they can have a part to play in improvement, and making not just improvements for the people that they are serving, but for themselves in their work and their colleagues. And so I wanted to see if people would come up with, you know, really key issues for me, like inequity, making better use of resources. So that's why I limited the wishes one, that they can ask for more money, because I know when we were younger, my brothers always used to say like we'd wish for more money, but I wanted people to actually think outside of that, because there's a lot of resource, but sometimes it's about how to use it differently, and how to share resources even among like different trusts and different organizations, and that can help sort of get further along where we need to get to. But yeah, I'll stop talking because I know other people will want to come in then.
Natalie, lovely. Thank you so much. That's I love your point about sort of the playfulness, and encouraging people just to give it a different spin on things. If you're going to pick one of these questions, Natalie, do you have it's a bit like which is your favourite child? I wouldn't ask my parents that. I'd know the answer. But if you're going to pick one of these as your favourite, Natalie, which would you pick?
I think number 1, just because it has the different elements to community impact right through to global.
Lovely. Natalie, thank you very much. We're going to give you a round of applause. Natalie, thank you very much indeed. Thank you so much for joining. Thank you for entering. We're going to come on, going at pace through, and we're going to come to Rachel. Rachel, good afternoon. Hello.
Hello.
Thank you so much for joining. Thank you for entering. Of all the entries, Rachel, I think you might win the prize for the most personal connection to the questions you put forward. Do you want to talk a bit about your personal, professional background and what you were thinking in terms of the questions?
Okay, thanks. And thanks for inviting me today. I saw the information about this competition on a chat at work, and my colleague Ollie had posted, and he said, it'd be a really good idea if people applied. And I kind of thought, yes, I will, and I'll do it now, because if I don't do it now, I won't get around to it, I'll forget about it. So I work for NHS England. I'm a project manager. I work as part of the Experience and Partnerships team. So the role that I do in my day job is very much about involving patients, members of the public, people with lived experience, trying to improve policies and provision based on people's needs. But I'm also a carer for my mum. I was a carer for both my parents, but sadly my dad died in June. My mum had a stroke 6 years ago, so she's quite disabled as a result of that. And she has carers coming in 4 times a day to help her with personal care, but I'm her carer, so I do everything else. And I just thought, well, what would I want? If the person I'm dealing with is like, let's pretend it was my mum or my dad, what would I want to do for them? Because as far as my experience is, and I think I speak for a lot of carers, is you want the very best for the people that you love, and there's nothing that you won't do for them. And it does also bring an anxiety as a carer. You worry that sometimes there's other things you should be doing and you just don't know what they are. So yes, it is very personal, and so my questions reflect that, but also I wanted them to be quite simple. So I didn't want them to be unnecessarily complicated. So that's why I thought, well, if I try and focus on what would I want for my parents, then that would be something that maybe can resonate with a lot of other people. And then looking at what do you want? That's the second question. Is we've all been in situations, haven't we, where we can think, well, how were we made to feel? What was the care like we received, and how did that make us feel? So I think that's another way of just maybe looking at the first question slightly differently. And then the final question, this is a coaching tool, part of something called the GROW model. So when you're coaching somebody and you're trying to support them with an issue or a problem, you would say to them, after they've described what they're going to do, and what else would you do? So it's just thinking about what else, because we've talked about working together in partnership and how important that is. So it was about looking at the synergy that working with other organisations and other people might bring. And it's not necessarily around health or care even, but it's maybe around social prescribing or other organisations or friends or family. So very much looking at the person in a holistic way and providing the very best for them.
Rachel, thank you so much, and thank you, just to echo the thoughts in the chat, thank you so much for sharing this with us. You make this point, Rachel, about you say simplicity, but there's so much actual complex stuff going on under the surface. Why do you think we sort of lose touch with some of what you talk about here? There's so much which goes on in interviews about this competency or that competency, but there's something so wonderfully grounding about your questions. Well, why do you think we move away from things which are just so important?
I think it's such a huge field, such a wide arena with lots of different specialisms, that it can be easy sometimes to focus on the specialism. And what we want to do is bring that back to focus on the person. And I give talks in schools for an organisation called Inspiring the Future. So I go and talk to primary and secondary school pupils about what's it like working in the NHS and the fact that there's more than 350 different job roles. And that's not including social care. So including social care as well, it's even bigger than that. And I just think because of the vastness of health and social care, that's maybe why sometimes we can not focus on the very simplistic but really important at the heart of the issue, the person.
Rachel, lovely. Thank you so much. I'm probably not the only one on this call wishing that I could go to a school where you're going to give a talk. Rachel, thank you. We'll give you a round of applause. Rachel, thank you so much for Thank you so much for sharing. Thank you so much for entering and joining with us today. We are going to come on to our next entry, which so this was a prize in two parts. There was a prize both for individuals for joining, but also for teams as well. And what we hoped would be that there'd be conversations across and within teams about, we should go for this, and what would it be if we were to? And so we are wanting people who may not necessarily have spoken to each other before, but coming together to put in an entry for this prize. Liam, had you ever spoken to the other person you put in an entry for this one?
It's funny you should ask that, Rich, because my teammate just so happens to be my wife. We're both in care, we're both GP trainees, and we decided this would be a great thing to enter together.
Liam, and I think Claudia can't be with us today, but thank you so much for putting in this wonderful entry. So as a pair of GPs, Liam, do you want to talk us through what you're thinking about with questions?
Yeah, sure. So I guess one of the main reasons we wanted to enter is because it feels like there's a real lot of tension around at the moment across the health and care service. So there's different parts of it being sort of pitted against each other sometimes, different professions pitted against each other. And the question that you ask, I guess, what is it that unites us, felt sort of really timely and something that we wanted to be a part of. And it just so happened that we were about to set off on a long car journey to visit my parents up north, and thought, what better way to spend our journey than talking this through together. So I guess in terms of the questions that we chose, we started by reflecting on some of the interviews that we'd had in the past, and they very much focus on the sort of what experiences have you had, what knowledge have you got, but very rarely, if at all, do they ask who are you as a person. There's something that's, I guess, fundamental that sits below all of our experiences and our knowledge that just doesn't get touched upon very often in interviews. And when we think about things like working together, collaboration, the scale of the challenges that we face, I think it's really about what sits below the surface of your experiences and your knowledge, and really who you are as a person that matters in that context. So I guess when you read our questions on screen, they might seem quite basic or quite straightforward. And in some ways that was very, very intentional. We tried to make these sort of design them as sort of three blank canvases, really, giving the candidate the space to sort of talk about what matters to them, a bit of space to be creative too. So what is it that matters to you in terms of your relationships, and what is it that matters to you in terms of the care that you'd like your family to receive? And then also quite an interesting question. We thought, well, how would you want other people to describe you in your role and what you achieve and the impact you have? So I guess all in all, our main reason for applying was we just thought it'd be really great to see at least one question that digs below the surface in an interview to try and get to the heart of what makes that person who they are.
Liam, lovely. Thank you very much indeed. And again, this theme coming through from across entries about actually how do you get to the person rather than just the bit of knowledge or the particular competency. And Liam, one of the things which really came through for me from your entry was that I was having a conversation with a friend who works in NHS finance. I was saying, these questions, would they apply to someone like me? I work in health and care. And there is something in your entry, Liam, which would work, I could see, across a whole range of areas. It doesn't have to be direct clinical care, but about that connection back to how we're all supporting a system which works.
Absolutely, it comes right back to that fundamental. One thing we were really keen with, this could apply to anyone, no matter which door they're coming through, as you said at the start, Rich. So yes, absolutely.
Lovely, great. And is there something particularly about the GP experience, Liam, which sort of led you to these? Is there something about sort of the pressures, which I'm sure you're working on today, which sort of brings you back to sort of the importance of this?
There's something about that, the pressures, definitely. But then I think there's something about the question you asked at the start about how many different roles you'd interacted with. And I maybe subconsciously and then today consciously saw exactly how many of those boxes I could tick, and it was quite a lot of them, which made me see on my sort of day-to-day we're trying our best to do this and the collaboration across different sectors, different professions, etc. And I think that and wanting that to work really well was why we were sort of so keen to get involved, really.
Liam, thank you very much
Thank
indeed
you.
to yourself and to Claudia. A round of applause. Thank you very much indeed. And so we'll come to our fifth shortlist entry and our second team entry, which is from Claire, Larry, Nikki and Nina. I know we have a range of you joining. Claire, you head this list, which I'm going to take as either you are the scribe or you are the most important. So I'll allow you to interpret that in the way that you would like to. But Claire, do you want to lead off? Thank you so much for entering. Do you want to talk about your team's partnership?
Yes, definitely the scribe. It was a very collaborative process. I hope you can hear me. I'm going to try and keep my voice down. I'm in the beautiful Wellcome Collection Library reading room here, so try not to disturb everybody around me. Yeah, we met as we're all NSK champions for the charity versus arthritis. Happens all four of us are physiotherapists, but there's many other professionals within that group. And having been involved in Kaleidoscope events before, you seem to have a way of bringing together such wonderful people that have innovative thinking and creativity. So when I saw this, I kind of put the call out to the group and said, would anyone else like to join in? So we had Larry, Nikki and Nina that fed into the questions. Nikki came up with the wonderful phrase collective soul, that we're trying to find a collective soul of people that want to do the right thing and to be caring and to provide great care. I think we were very conscious of the fact that it's not just direct caregivers that provide care and healthcare throughout this country and across the world. All those support services that are involved as well, we wanted to make sure that the questions would bring them in as well.
Thank you. And just to say, we can hear you loud and clear. And I think you get the prize for the best chandeliers in backdrop. I know Nina is with us as well, and I might come to you, Nina, in just a second. But Claire, can you just talk us through the third question here, particularly? Which I've had a number of people talk to me about it and either say, oh, that's amazing, or just practically, how would that work? But there's something really open about that question in a way which many others may not be. Do you want to talk about that one in particular?
Yeah, this one, we wanted caring in there. I think that's just a core element of what we want that collective soul to be. But I think, having been somebody who's interviewed many people over the years, there's nothing more frustrating than having somebody in front of you that really struggles to get their question across, and that can be because they're not great in interview, English isn't their first language, maybe neurodivergent. So Nina can probably expand a little bit on this because she did come up with the thoughts of this, but we wanted to be really inclusive without alienating people that like a traditional interview, because if I got that one, I'd be like, oh my goodness, just ask me a question. And that gives the option for people to come in with their answer to their question, but it also lets people explore that in a way that their brain may not be the type of brain that can just rattle off an answer in a question. It gives them time to think, it gives them time to prepare, and then to be able to express themselves in whatever way they wish to. And I think one of the things that you put forward as a challenge was being creative. And I'll maybe hand over to Nina because she came up with the idea of the creativity for this one.
Lovely, thank you. Nina, would you like to come in?
I think you very much said it, Claire. But the flip side to this is also who you can have on your interview panel, because you very typically we're used to people taking a very hierarchical approach with that, and I've some experience of doing interviews that were value based, and what it meant was that instead of, so for example, within our physiotherapy department, instead of the panel having to be of people of a more senior grade than who you're recruiting, we were able to invite our HCAs and our admin staff to be part of that interview panel, because it didn't have to be knowledge based. It didn't have to be about a muscle attachment. it could be about what we really cared about, which was the patients, and that these sorts of questions allow you to unpack that, and they're just as capable as the rest of us of ascertaining that. And also, you know, just that experience of recruiting people who are great at interviews, but you're not necessarily you know, getting the best person. And I don't know if this is any better at it, but it's certainly, you know, it's that adage of what you know, the stuff you were talking about before. If you know, if you always do what you've always done, you're always going to get what you always got. I've bastardized a quote there.
At all. Nina, thank you very much. Last one for me, and then we will move on. And Nina, how was it doing as a team of 4? Did you all agree? Did you fall out? Do you still look at it and go, well, that's my question, but that one I really dislike? How did that part of the process work for you?
I think it worked brilliantly, and mostly because Claire facilitated it. So I think what it did was to allow us all to put some thoughts down. And then I certainly looked at it and went, oh gosh, yes, that's what we always do. No, let's be more creative. It worked really well. And by having a collaborative, I think it really brought the best out. But having Claire pull those strands together really worked.
Nina, thank you. This is a prize about collaboration. So if you'd come out and said it was awful, you know, we fought the whole time, you know, it'd be honest, but maybe less in keeping. Thank you very much indeed, Nina, Claire, and also Larry and Nikki, not with us. Thank you very much indeed for your entry. Lovely stuff. Okay, thank you, everyone. Time rattles on. And we're going to come just to hear from a couple of our judges before the main event. So to say that all of the entries we received a wide volume of entries, of which the top 5 here were the cream of the crop. But our panel was the wonderful Alison, Anna, Bhavna, Thais, Victor and Zoe, but also Ceylan and David, who are joining us this afternoon. Ceylan and David, thank you so much for being part of this process throughout. David, we'll come to you first, and then Ceylan, if that's okay. David, do you want to say a little bit about, look, you've got lots of other calls on your time. Why on earth did you get involved with this?
Well, thanks, Rich. Hi, everybody. I suppose, as I set out in the little blog I did for Kaleidoscope, I think as a journalist, I was struck throughout my career as to how on earth such unsuitable people often ended up in health and care services that led to many of, you know, the scandals we've been all too familiar with through the years, Midstaffs, Winterbourne, Walton Hall. And you know, why can't we screen these people out at an earlier stage? But also now I chair a charity called Ambient Support, which provides care services, and you know, our turnover is, you know, not untypically north of 30% a year. 50%, more than 50% of the people we recruit stay less than 6 months. You know, this is costing us probably £2,000 per appointment. And if we can get turnover down and actually attract the right people who have the right qualities and are going to stick with the job, then that's a real win-win for us.
David, thanks. We'll come back to you in 1 second. Ceylan, same question. What made you want to, when you received the invitation to join, what made you want to join in with this project?
Maybe because my ex-boss asked me to. I am also someone who worked at Kaleidoscope just in the last year, so I know about how Kaleidoscope kind of creates these kind of creative challenges and questions about healthcare and collaboration. So it's quite a great joy to see an interview question competition, considering I've been applying for grad schemes every single day recently. It's good to see a new set of questions after the typical kind of personality questions I've seen. But also, if we use the strategy and management term, I am a frequent service user of healthcare. Because of my Crohn's disease, I'm almost always in some form of healthcare setting. I will be in hospital for my infusion next week. And the staff members and the teams that always stand out to me when I'm in healthcare settings are those who really care, who have that empathy and collaboration. And a lot of the time, the reasons why I get to my appointments faster, or I get the care that I need for my personal needs, is because I've got collaborative teams working for me. And so if that could be expanded to everyone else, because I've heard a lot of horror stories in patient sectors, it'd be great to have these kind of questions, as we said, to weed out those who aren't really motivated for that kind of empathy and collaborative nature of healthcare, so that everyone else can get those kind of experiences that I've gone through as well.
Ceylan, lovely. Thank you very much indeed. David, back to you. Last one for me. And so, what particularly interested you in the entries you received, and what sort of reflections do you have, given the particular vantage point you have on the health and care world?
I think Victor Montori, who was another judge, and he did a blog, and I commend it to you, where he just posed lots of questions, and one of which was, in terms of team working, is it what you bring, or is it how you fit with others? And he kind of concluded rightly that it's both. And he likened it to being a piece in a jigsaw puzzle, and particularly if you're a corner piece, or most especially the last piece that finishes the puzzle, then you're a really special appointment to a team, and that set me thinking around teamwork and around what we're looking for. But the other thing that struck me was a lot of the entries, and we've heard tonight from the shortlisted entries, pose the question, what would you want for yourself or for your family member? And Andrea Sutcliffe, who used to be the Chief Inspector of Social Care at the Care Quality Commission, she always, in all her presentations, she always had the mum test, and she put a picture of her mum up and talked about the care and support needs of her mum, and that really resonated with her audiences, and I think that's something that we need to think more about in terms of how we translate these messages to a wider audience.
David, lovely. Thank you very much indeed. Mums or other parents are available. Ceylan, we'll come to you again. What really struck you from the entries which you read through? What particularly resonated?
I think it was the creativity. I think a lot of the time in healthcare, maybe it's because of the monotony or the time restraints, there's not a lot of place for people to flex their creativity, and it's often those moments of creativity that we get the improvements in healthcare. It's someone thinking outside of the box. It's someone looking at a situation completely differently to what maybe the typical healthcare perspective might be. And so I was really surprised by how much creativity there was. I still remember some of those questions that were a bit more abstract, things like extra long arms, and completing tasks together if one member of staff were to keel over in your clinic. But yeah, I think it's the creativity that stuck out to me.
Yeah, lovely. Thank you very much for David. Thank you so much for being part of the prize. So on behalf of all other judges, we'll give you a round of applause just for your contribution. Thank you very much indeed. If you were to go on the Kaleidoscope website, you will find lovely blogs, both by David and by Ceylan. So please do have a look there. We are getting to the main event, which are the winners of our prize. So I should probably extend apologies to all the shortlist entries who say, look, can we not just have done this first? Let's just get it out of the way. For the individual prize, there is a top prize of £1,000, and I'm going to pass to David for this one. David.
Thanks again, Rich. Well, three tremendous entries, huge qualities in all of them. But overall, we felt because of its creativity and originality, the best entry was that from Kelly Henderson.
David, thank you very much indeed. And Kelly, congratulations. Range of comments here coming from the judges, particularly citing their sort of insight, creativity, originality. Kelly, we will be in touch about translating that to dollars, but many congratulations indeed. What we'll do is we'll do team, and then we might come back to yourself, Kelly, and the other winner just for any reflections. Ceylan, we're going to come to you for team. Ceylan.
So yeah, for the team prize, it'll be a total of £1,500, and we had very good entries. It was so great. We were really fascinated by, again, the creativity. We really found the rationale and kind of the wide applicability of the questions. That was why we kind of ended up choosing this group. And so the winner for the team prize is Claire Spear, Larry Koyama, Nikki Fowler, and Nina White. Congratulations.
Ceylan, thank you very much indeed. Claire, Larry, Nikki, Nina, congratulations. Claire, I'm hoping that you're making too much noise for the Welcome Library now. But again, judges praising the rationale, the care in the questions, the inclusivity in that third question, which we talked a bit about, and the applicability. Congratulations as a team. We will come back. Kelly, any reflections? Kelly, congratulations on winning our individual. Any reflections, Kelly?
Thank you so much. I'm very honored and excited, and I love being part of this conversation and just hearing about everybody's thoughts and ideas on the different questions. And thanks to your team for putting this together. It just kind of speaks to when you create opportunities for people to open up their ideas and think more broadly and start to question how things are working today. There's so many like new ideas that can come out of it. And so I'm just grateful to be part of this project, and thank you so much, and really excited. Thank you.
Kelly, congratulations once more. Claire, Nina, congratulations. Any immediate reflections?
Thank you. We're delighted because I think all of the questions were fantastic, and I personally have taken a lot out of that. We are donating the prize money to Versus Arthritis, so really delighted to be able to give them a good wad of money as well. It's been... Oh, I'm back to Nina.
We lost you for a second. Nina, over to you.
Yeah, no, I'm just really appreciative of the experience, and I haven't heard of Kaleidoscope before, but I'll certainly be watching more of what you do, and hopefully we'll be taking down all the questions that you've shared, so that the next interview will just be mind-blowingly creative.
Nina, thank you very much indeed. And congratulations for another round of applause for all of our shortlist entries, including Kelly, Natalie, Rachel, Liam, Claudia, Claire, Larry, Nikki, and Nina. Congratulations all. Thank you so much for entering. Again, we had a wide range of entries across both the individual and team categories. So to be within our final five was really quite some competition. So thank you very much indeed, everyone. What happens now? Right, okay. That is the prize is done. But this has all been about, actually quite a firm belief from us here at Kaleidoscope, is that given where we are heading as Kaleidoscope, some variant of this will happen. We will get to a point where we start to think about what is that common door, what is that shared purpose, how do we support that from the very start. Things take a while to change in healthcare, so we might be talking about this being a 2030. Perfectly legitimately, this is a project in the centuries. David mentioned one of our fellow judges, Victor Montori, who talks about change in medicine, a bit like how the great European cathedrals were built. The people starting to build them were not the people who were there at the end. And that this endeavour of long-term change is one which we only ever play a small part of and can never quite see it through to the end. So there is a long-term trend here about how we can help all those across health and care work well together. Which does make it a bit tricky in terms of, okay, well, who's going to live to 200? Well, maybe, you never know. But one of the things which we talk a lot about at Kaleidoscope is the importance of micro actions. Change in health and care, sorry, can sometimes seem so vast that it's quite hard to think about where to begin. This concept of micro actions, this idea of things which are barely noticeable, or they feel so insignificant on their own, we use a lot. because this is, in our view, how real change happens. It's this cumulative effect. It's this one small action after another, repeatedly, which has this compounding effect. So our challenge to you, just in leaving us today, is just to think about, don't worry too much about the 200 years, that'll sort itself out. But actually, just in terms of the next couple of weeks, who are you going to talk to about this? The next time that you are recruiting or sitting on a panel, how could you start to use some of the thinking which we've talked through today in your recruitment? Again, it's that compounding effect. If enough of these small changes happens, then we get to the big change over time. So it's a bit mean at 4:56 on a Friday to say, and here is your weekend homework, but here is your weekend homework. And do think about those small changes which you can make, starting with the conversations, how you can take this beyond where we've been today. We'd love to be able to help as Kaleidoscope. We have very lovely little hard copy books of all of the shortlisted entries, along with some of those wider questions which we were talking through. If you'd like a copy, or even if you'd like several copies to give out to friends, colleagues, countrymen, please do get in touch with us. Our email address is there, but also do come through the Kaleidoscope website as well. We're very happy to pop free of charge one or several of these lovely little books in the post for you. There's lots more about the whole What Unites Us project on the Kaleidoscope website. And if you think there are particular things that we should be doing further than this, do get in touch. As Kaleidoscope, we help people with collaboration. If that's of interest, get in touch. We can have a coffee, real or virtual. There's a newsletter. I'm sure many people have signed up, but if you're not, please do. And we run further projects and events like this. With it being 4:57, we'll give you 3 minutes of your day back and say thank you once again for joining today. Thank you to everyone who entered. Thank you to all of our judges. Thank you to everyone who's joined today. We hope you've got as much out of the project as we have, and we hope you have a lovely weekend. Thanks very much, everyone. We'll see you again at another event. Thanks all.